Welcome back to the show, folks. We have a fantastic episode for you today. We're diving into oral health. You've probably heard that your health begins and ends in the gut. Well, what a lot of people forget is that the gut begins in the mouth. So that's where we're diving in today. But I also want to thank you guys for your support and for keeping us floating in the top 5 positions in our category on the podcast charts for weeks on end. So thank you for that from the bottom of my heart. And also, I have a thank you gift for you. I have a small gift. All you have to do is go to natnidham.com/top 5 and you will get a list of my top 5 peptides, the peptides that I think everybody needs to know about. Doesn't mean you need to use them all the time, but definitely 5 peptides everybody needs to get to know. All right. So if you're feeling inspired today, don't forget to leave us a review on whatever platform you're listening to this podcast on. And if you know of anyone who you think should get this information as well, make sure that you share it with them. Drill and fill dentistry is officially outdated. Today, I sit down with Dr. Nammy Patel, a functional dentist who's bridging the gap between root canals and root causes. We talk about why she tests patients' spit to assess cardiovascular and cognitive risk, how jaw expansion can improve sleep and nitric oxide production, and why outdated dental work might be holding your health back. If you're over 40, you will especially want to hear why she says now is the time to test, optimize, and reset your oral health before symptoms even show up. Dr. Nami, welcome to the podcast. It's a pleasure to have you and to have this discussion today. I'm really excited.
Me too, Natalie. I'm very excited. I've had the pleasure of checking out the podcast and all the things you're up to. I'm really excited to be able to have some good conversations here. And I feel like they're going to be a lot of fun because you have a wonderful background.
Well, and I'm excited to learn more about what you do. Like I've recently, over the last couple of years, transitioned over to a much more holistic minded dentist myself. And it's really a very different experience. So before we kind of get into that, because it differs wildly from conventional dentistry, and typically your conventional dentist is going to have a much nicer setting than your, like the last conventional dentist I went to, I swear to you, I felt at the end like I was walking into a war zone. Like they still had plastic dividers back from COVID days. And so, and the place needed a paint job. Like it was pretty depressing. I was like, okay, but that in and of itself is not a reason to change dentists. It's just that being in the space I'm in, you start to get exposed to this whole other reality of what's going on in the mouth. Like it's not just about those pearly whites and, maybe obviously they'll look at the gums as well, but there's not a lot of attention that's paid to much else. And when you start reading, like I think, when was it, in the late, like 2018 is when the big kerfuffle happened around the link between dental oral health and Alzheimer's, and people started to think, oh, wait, what do you mean? How's that even possible? Or oral health and cardiovascular disease. And suddenly the mouth started to become a different focus for health. But I'm curious with you, like when you went to school, you probably didn't go to school for holistic dentistry. You went to school for conventional dentistry. So how did you make the leap and the transition to probably what's a very, very different practice?
That is a really great question. Honestly, I started in dentistry. I went to USC, University of Southern California. What I loved about my program was really great because it was like Harvard's program. It was more like medical school. It wasn't just dental school. If there's a hole, let me fill it. I actually had to learn about so much more than just the mouth. Like on the first day of school, we didn't have teachers. We had to start learning for ourselves. So you would get like one line of information, which is Mrs. Richardson comes in and has trouble swallowing. She is 44 years old, and that's the only information you got. And from there, we took a week to really extrapolate. Okay, she has trouble swallowing. So what could be all the things that could cause her to have trouble swallowing. Could it be that she's menopausal? Could it be that she has a dry mouth? Could it be that she has maybe reflux? Maybe there's something wrong with one of her esophageal sphincters, and just things that are so outside of just the tooth. So we really had to start looking at how the mouth is related to the rest of the body. And now I've been out 20 years, so it was a really great way for me to be primed and always look at what is the connection? How can I really get to root causes? And it wasn't just about a symptom. It was really about what is really causing this problem so we can fix it. So that was my initial start to really looking at root causes. I also come from, I'm East Indian. And so I come from a background of Ayurveda. And we really focus on how do we help and use natural modalities, right? We're disease prevention, lifestyle focused, and what can we do to make sure that we live a long, healthy life? And in Ayurveda, like for example, the way we cook, curcumin was like a great big buzz and it's a great, thing now. But honestly, I grew up eating curcumin every single day. You just need a pinch. It's part of our daily meals. And so those lifestyle focuses is how I actually grew up. And so I looked at when I got out of dental school, I didn't want to be like every dentist. I wanted to be something where I felt like I was here on this planet to serve a purpose and I wanted to be different. And I said, well, what's missing out there? The first thing I saw, which was missing, was a lot of, partnership with the dentist. It was always like, you're bad because you're not brushing your teeth. You're not flossing. You need to do this better. And there's all that guilt and shame that went around it. Well, in fact, I have so many patients, that's not their problem. They're great at brushing and they're great at flossing. The root causes of their conditions are completely different. Some of them autoimmune disorders, some of them are, side effects of medications. Some of them have dry mouth. Some of it is aging. Some of them don't have enough vitamin D3. So there's a lot of reasons that a lot of these things happen. And so that co-partnership with the patients and really respecting them and really figuring out the root cause of their condition, which takes a lot of time and energy, but it's so important. And most practitioners are so drill and fill that they want the patient in and out as soon as possible. It's like, a cleaning is like 30 minutes, and for us, we take a full hour. We take photos of all the teeth. We're really analyzing. We're doing our own microbiome test. We're looking at the genetic risks. We're doing a lot of different testings and really figuring out how our patients are doing so we can serve them better. And really, it's more personalized, customized care and with data-driven, personalized, customized care. And that's really where I saw that I really could make a difference. And that's how I started my practice. And I learned so much. It was really great. I went to the Biohacking Institute on how to prevent heart attacks. I went to Apollo Health on how to prevent Alzheimer's. I actually even went to Kalish Institute for Functional Medicine and did training with them. And I really deep dove into how the mouth is related to the rest of the body. You don't hear dentists talking about oxidative stress. We need to be looking at oxidative stress.
No
it's
kidding.
kind of important.
Yeah.
Your tongue position is super important in oxidative stress. Making sure you're breathing through your nose is really important in all of these things. So really looking at, just deep diving and, being more detailed and really not just surface level, but really looking at what is really going on with the pathophysiology of the body. Like, how is the body working? Because it's designed to work. It's an amazing machine. It is designed to work. And if something is off, we got to figure out why. It's not that you're not brushing your teeth. That's just so beyond, that's so basic. It's not about that. It really is a lot about, hey, maybe you need hydration. Maybe you need to have different electrolytes. It could be so many different things. And really taking the time to just dig deep, figure out the root causes and address it. And sometimes there's multiple layers. It's not just one thing. Sometimes it gets down to, the MTHFR gene. Some people aren't able to convert the vitamin D3. And we really have to start deep diving and really looking at individuals, not just mouths, but an individual person and how their body is really working and how can we optimize it? That's the other piece. Like, I want to get rid of disease if there is disease. Secondly, I want to optimize it because we're now living longer. Did you know that keeping your teeth adds an extra 10 years to your life? And even beyond that now, because we now know the specific bacteria that cause, Alzheimer's, so we can help prevent that. We can actually expand your upper and your lower jaws to make sure you get enough nitric oxide naturally, because your body does do it naturally. And how can we do that to be able to make sure form and function go together?
I mean, and it makes so much sense, right? I mean, to treat this entry into this point of entry in the body as not influencing and being influenced by the rest of the body is like, it's this crazy concept if you think about it, right? It is the beginning of the digestive tract. It's where the outside goes in. Or at least it's one of those points of entry. The other big one is the nose. But you mentioned a few very interesting things here, but I want to start with the oral microbiome. Because before we started recording, you mentioned that, there's a member of your staff who's been diagnosed with a fairly serious condition. And you had said that, when you'd looked at this person's microbiome, you would notice the presence of certain organisms that may have indicated that there was trouble brewing. I mean, it wasn't a diagnosis thing. But I'd love to dig into the oral microbiome a little bit, because you've mentioned a bunch of things, right? So you've mentioned cardiovascular disease. We mentioned Alzheimer's. There's oxidative stress. There's, any other serious medical condition. To what degree to what degree do we see it as a starting point or just a reflection of what's happening in the body? And probably it's a little bit of both. How do you test the oral microbiome and go from there?
The easiest way to test the oral microbiome is through a spit test. And my personal favorite, there's a lot of different tests out there. I tend to like things that are highly specific, medical grade. I don't want to just know if I have bad breath. I really want to know if I have any presence of bacteria that's going to give me a heart attack, diabetes, cancer, Alzheimer, arthritis. And so the test that I actually use in my practice is called oral DNA. And the reason I like it is because it does a PCR analysis. So it's not just, we want to know how much of this bacteria do we actually have as well. Not just the presence of it, but how much of them do they have? How much do we have? Because it does change as we get older, especially starting in the 40s, 50s. And so we really want to test these things. The second thing I test for is genetic risk for inflammation. Now, interleukin-6, it's a very broad marker. It's what mom and dad give us. And I look at it 30,000 feet up. I'm a dentist. I realize, I haven't done all of medicine. I have a good background, so I'm respectful of that. So just really looking at how can I contribute and help my patients. So I always look at the 30,000 feet up, looking at, are they at high risk, low risk, or medium risk? So when I see my patients with high risk of this genotype, which means that they're actually at a high risk for heart attack, diabetes, cancer, Alzheimer's, arthritis, osteoporosis, also gum disease, because they're all controlled by different inflammatory markers. My favorite one is called tumor necrosis factor alpha. I just love talking about it because it's involved in everything.
We love TNF alpha. Yeah.
So really looking at these. So the first thing I do is I look at the specific bacteria anytime, and there's specific ones. So we have green light, yellow light, and red light. The red light are the worst ones. And so the red lights are the ones that are causative, in particular AA and then PG. So AA is causative for heart attacks. PG is causative for Alzheimer's. So we've actually looked at these. What we find in patients who have tumors or cancers, and those of you listening, we just, before we got on the call today, one of my staff member had just told me, hey, Dr. Patel, she actually is remote. So she's been working with me a few months. And I said, you know what? You need to see what I do. Come into the practice, take a look, let's do our oral microbiome test. We did her oral microbiome test, and she had just gone to the dentist in December, where she lives. And so they are like, oh, you're fine. You don't need anything. No worries. When I see her, I look at, I did her microbiome test, and I looked at her tongue posture. The first thing I said to her is like, there's something going on. Let's look at this, like go back in for the physical, The first thing I noticed is that she had specific bacteria that overgrew. And especially in her we found FN, PG, we had TD and TF. So those red light bacterias. And those bacteria are actually, what they do is they actually make tumors overgrow. And so I shared with her like, hey, I'm going to clean you up dentally, obviously, because you're here. I did a deep clean with laser, and I said, we're going to do a follow-up test and see how things are looking. And she's like, oh, thank you so much, Dr. Patel. I'm going to take this to my medical doctor because I have a physical coming up. And of course she did. She shared with the doctor the findings that I gave her. And, they found a tumor. The good thing is it's small and they're getting it early, which is so important, that early diagnosis. And honestly,
but how amazing that you were able to point to something's off, and send, because her doctor may not have looked for it, right? Like, could it have been missed?
Yes, absolutely. The thing is, and all it took was a spit test. To do a spit test takes, maybe 5 minutes, you swish around for, 30 seconds or 2 minutes, and then we analyze all the information. So just really looking at that piece of information, it really gave us a lot of information. The second thing is, when I saw her, I noticed that when she would speak to me, I would see a lot of her tongue. So if you notice, I know that we're seeing each other, visually here, but people, who may be listening to this are not able to see this. But what we actually do is, what I'm actually doing is paying attention to patients when they're talking, because if I see a lot of that tongue action, like when you talk to me, you don't see a lot of my tongue. There are patients, or there are
mine. Now I'm all.
You're good. I checked you out already.
Oh, geez. And I didn't even know I was being checked out.
So those are the things I'm looking at, right? And so that when I saw her and I was like, hey, you've got scalloping on your tongue. I could see a lot of your tongue when you talk. I feel like there is something going on. We need to evaluate your functional airway, and because we want that nitric oxide, right? Because if she did have a tumor cancer, nitric oxide would be a molecule that would help reduce that for her. So we actually got her on to doing her CT scan, sleep study. Turns out she's apneic, which her medical doctor never checked on. And I was just like, I don't understand why, medical doctors are not doing that. And believe it or not, she's actually had 2 strokes in her life.
That she knew about, or that she didn't know about?
No, that she knew about. And so the medical doctors, she had those strokes. She went into the medical doctor, but the doctors never, ever, ever looked to evaluate her sleep, to evaluate cardiovascular conditions. They basically told her, you need to lose weight, and that's it. If somebody's apneic, they're never going to be able to lose weight. It's so hard.
No, but it's a vicious circle for sure.
Exactly. And it's not until she started working for me, and she was working in a hospital, believe it or not. And it's not until she started working for me that she really started realizing all of these things. And then as we started talking more and more, she was like, I'm really going to go get a second checkup and get my blood work done again, and maybe look at some things, because this is my first time hearing this, number one, from a dentist, right? And then just really understanding what it all means. And because sometimes it can be scary, having your dentist tell you, hey, you might have something going on that caused a lot of these conditions. It puts people on alarm, but hey, that's what needs to be done, because we want to diagnose earlier. We want to live longer. We want to be healthy. We don't want disease. We don't want dysfunction. We want to look at it earlier. And if going to the dentist is something so easy that can help us, that is amazing. And just being able to help her has been fantastic. And our office manager is already talking to her, seeing how we can help her and support her. So we're already on those pieces for sure.
That's amazing.
So yeah. So it's just really interesting. Like I had no idea that I was going to get that news before you and I spoke this morning. Right. And so, I'm really happy that I could be a part of her team to help diagnose early, and that she can get treatment done and to be able to help her. And especially, she's like 34 years old.
She's young. Yeah. That's insane. I mean, just even being diagnosed with cancer at that age is pretty scary. So the spit test, I mean, I go to a pretty holistic dentist. And I don't know that she's ever looked at my oral biome. That's really interesting. What's interesting about the oral biome also is it would be so much easier to assess than even a stool test would for the lower GI tract, because the lower GI, when you do a stool test, it's a place and a moment in a speck in time, whereas a spit test is representative of what's happening in the mouth. Well, pretty consistently. I mean, and they're going to report on very different things.
Yes.
Like it's two opposite ends of the spectrum.
That's actually a really good question. So the reason I like the spit test over a stool test is, of course, they give you different information, but and also you said it first, the mouth is the beginning of the gut. So how is your stool ever going to be fine if your mouth is not? And that's like the common sense thing, right? As much as I want to say that, because it just makes sense. Like if the mouth isn't right, there's no way, like an example I would use is majority of my patients who have H. pylori, I see an increase in FN. And I was like, you're never going to be balanced. There's just no way we can balance you unless we get this FN under control, because we got to think about the microbiome in a specific way, right? It's kind of like a pond. It has koi fish, it has different things. So we got to look at a lot of these, organisms, because they have to coexist. It's like ecology, right? So
100%.
like it's like ecology. Yeah. So we have to keep these organisms in balance. And what we find is that when there is an overgrowth of one or another, it changes the entire ecosystem, right? That's why we see algae. That's why we see, there's that sulfur smelling bacteria. There's color changes, So it's really important that we balance things properly. And so when we look at the oral microbiome, it's just, there's no way we can get that in balance until the mouth is in the proper place. The second thing I was going to say is the reason why I love the spit test is because it's a secretory fluid.
Yeah.
So we really want to look at the mouth because it's a secretory fluid, because when we see the mouth and the spit inside there, we see that if there's something in the blood, we'll be able to find it in the mouth.
Really? Like what?
So like one of the biggest things about doing as a prevention so one of the things I'll find is there's some patients who have cancer or something along those lines, right? So what I'll find is I'll do their oral microbiome. I'll see all the red light bacteria spiked up. We do their deep cleaning. We do all the work that we need to. And then I take another spit test. And then I find that bacteria still in the mouth. And I'm like, hey, your mouth is spick and span. I just stained you. I double checked everything. It's not there. It's not that you didn't brush your teeth. It's not that. There's something deeper going on. Yeah. And that's when we know there's active disease. So that's when we really see that there is active disease, whether their LDLs are super high, whether they have concerns with Alzheimer's, whether they just so many, or like PCOS, even tumors, right? So just things like that. It's really amazing what I can discover from a spit test. And I mean, to say somebody from a spit test, from a dentist to say, hey, I think you've got something deeper going on. Your doctor needs to take a better look and dig deeper. That's
incredible. So is this test readily available? It's called oral DNA. Is it only available to dentists, or can somebody, how consumers can buy a microbiome test, or they could buy a DNA test? Is it just a professional test, or is it the kind of test that as a consumer we could get, and then I guess then we'd have to find someone to interpret it for us, or is it already done?
No, the oral DNA, I believe, is only through doctors, dentists, naturopaths. There are tests that are out there that are, consumer can purchase. It's just not to the level of detail that it is. So here's what I always say, and I want to be really realistic, because sometimes, people are just curious. If you're curious, you can try something at home that you can do, and it's, gives you the results. But if you're somebody who actually has IBS, has some sort of a disease, if you're focused on longevity, anybody after 40, we need to do an oral DNA test, because 40s is when disease starts really happening, and that microbiome chart starts changing very quickly. And the other reasons why I say that is because it's no longer just about hydration. It's no longer just about the mouth. Our bodies are getting taxed even with the food we're eating, plus the air quality is now a risk factor for heart attacks. So now the risk factors just go up so much more. And that's why I made the bold statement about 40. Disease takes about 13 to 20 years to develop. So if you're 40, you want to start looking at your 50s and 60s, right? The other thing that occurs is that there's some physiological changes that happen in the mouth, believe it or not. And the most important is your tongue posture. Just like we get wrinkles on our face, we get wrinkles on our tongue. So the first yeah.
Oh my God, no.
Yeah.
All right, so talk to me about the tongue. That was a question I had written down here. So let's, because my dentist does talk about tongue posture a lot.
Yeah.
So, and I actually interviewed another woman, Annette Verpilot, who has a company called Posture Pro, and she works with the tongue a ton. And it is transformative, the work that she does with people in terms of how they hold themselves in space. But now let's talk about the tongue from where you're coming at it.
So the tongue is really important in so many ways, because the first reason, the tongue is important, of course, we have taste and things like that. But my main reason for really looking at the tongue posture is several-fold. You already mentioned that it's always really important for, your overall posture. Obviously, your tongue balances your TMJ, and it really helps your body be in the proper shape. It also helps your spine be in the proper shape. So all of those things are really important. The other things that we're looking at with the tongue is that if there's a small palate, if somebody had thumb sucking, if they had teeth extracted, the tongue doesn't have enough space. When the tongue doesn't have enough space, usually they're probably fine in their, early 20s or something like that. But usually right around like late 30s or so, we'll start, mouth breathing will occur. And then by 40s, what happens is that just, our collagen fibers unravel. That's called aging. That's a natural process of aging, is that collagen fibers unravel. That's the reason why we get wrinkles and stuff. So when we can see those things, we can anticipate problems, because the first issue that we start looking at 40 is sleep-related breathing disorders. So that means you start mouth breathing. If you start mouth breathing, your mouth is going to be dry. If your mouth is dry, you're going to make bad bacteria overgrow. So especially the red light bacteria I talked to you about earlier, that are causative for Alzheimer's, and they're causative for diabetes, and they're causative for heart attacks and tumors and things like that. They're actually caused by, a lot of it is caused by dry mouth. And that all occurs as a natural aging process. By 40s is when the collagen fibers unravel. By 50s, it happens even more. By 60s or 65, pretty much everyone is diagnosed with some sort of a sleep-related breathing disorders, but it's the number one thing medical doctors are not looking at. They will happily prescribe you a hypertensive pill. They will happily give you an anxiety pill. They will happily give you something for your restless leg syndrome or for your ADHD, but will not notice that, hey, this is easily correctable without any medications. All we need to do is put form and function in the right place.
Okay, so where should my tongue be? Where should people's tongue be?
Okay, so if this was if this is the roof of your palate, I want the tongue to be right there. So, and you know what you'll find, actually, this is really interesting, is in yoga, a lot of times you'll hear, put your tongue at the roof of your palate. When you're able to do that, what is going to happen is you're going into your vagus nerve response, your rest and digest, your posture changes, everything changes. And, I have an interesting story I want to share with you, because, yesterday I had a patient come yesterday, and I was so excited. She's been I've known her for a while now. And so she was, I think she's 38 years old. She's been wanting to get pregnant. And she was like, Dr. Patel, I'm just too stressed. Things aren't working, And I told her, hey, we need to fix the airway. I was like, that's the issue. And she finally was like, I'm not ready for the full commitment yet, but can I just start with one thing? I said, of course, let's start with one thing. So I did a tongue tie release.
Yes.
So I did she had a low tongue posture. So I did a release for her, and it's now, and then she, I saw her for post-op, and she's like, oh my God, my acid reflux is gone. I'm feeling so much better. And, but mind you, she never told me she had acid reflux. She was just like, she's like, I'm feeling so much better. And then yesterday she came in and she told me, she was pregnant.
Wow.
Because one of the biggest reasons we're finding that women, don't get pregnant is two reasons, actually. One is stress, the cortisol levels, right? Your body needs to be prepared because it's, building an organism. The second is nitric oxide. When you're breathing through your nose, you create that nitric oxide, and nitric oxide is needed to keep that uterine lining. So, and now there's such research. Nitric oxide
is crazy.
It's amazing. So I was really excited to be able to share that with her. I was so happy to hear that. I mean, just beyond. I was like, yay,
Wow, that's amazing. So the tongue tie release, is that called a frenectomy?
It is. A tongue tie release or a frenectomy. A frenectomy usually are ones that are on the cheek side. So we do a tongue tie release. And a lot of them are done for babies because they can't latch onto the breast. But people forgot about the adults.
Well, it's funny. My 24-year-old just had a tongue tie release done, but it hasn't fully resolved his sleep issues. But, I think the next step that's been offered to him is a laser treatment of his of the palate.
Right.
To see if that helps. But what she really wants him to do is the Invisalign braces, and his teeth are, if you look at him, this is not a kid who's got bad teeth at all. And he's like, that's a hard no.
Sure. Is it all right if I share with you what I would do in that situation, Natalie? Sure. So if this was my son or daughter, what I would do is Invisalign actually only tips.
He's going to kill me. Sorry. Okay, go ahead.
I would not do Invisalign. The main reason is if the sleeping issues are not resolved, that means the tongue doesn't have enough space. So the release is really great. That's one part. The tongue really needs more space. So if they've ever had a history of braces when they were younger, or their palates just didn't develop, because part of what's happening now is that, evolution is occurring. So what's happening is that our upper nasal cavities and our jaws are becoming smaller, and our heads are becoming way bigger, right? So, but then the tongue is a muscle, so it's growing. And so the tongue doesn't have enough space. So our options are to, the laser is great to shrink the tongue, but it only lasts for a short period of time. Usually 2 years is maximum. What I would suggest is actually expanding their upper and lower jaw. The reason being, we now actually have appliances that activate the stem cells in order to expand the upper and the lower jaw. The reason I recommend that is because if you expand the upper jaw, and this is my friend Bernie, those of you who may be listening, I have a skull here.
We're holding up a tie-dyed skull. So anybody who's listening to this, head on over to YouTube and meet Bernie in person. Yes.
So now Bernie, if you expand this upper jaw, because these bones are connected, you're naturally going to open up the sinuses more. If you open up the sinus more, you're naturally going to get more nitric oxide.
Right.
And when you expand the lower jaw, you're going to actually expand the windpipe. So your windpipe is a circle. So you end up increasing it by 1 millimeter. You increase the volume of air by 100. So we're all obsessed with VO2 max. This is how we utilize our facial structure to, just so that you're not getting VO2 max when you're running or when you're exercising, but really, how can you do it all the time? And it becomes even more important as we age, because one of the things, we're shrinking, right? As we age, we grow. And then, as we get older, we shrink because there's resorption. So we want to expand that upper and lower jaw. So that way we get that functional airway going. And we're getting that nitric oxide on a natural basis, not, that way we're not, really looking for supplements. I tend to like to be as natural as possible.
Yeah. Well, nitric oxide is a funny one. Definitely tapping into the body's ability, making sure that all the pathways of the body has to make nitric oxide naturally is really important. And you're mentioning some stuff here that very few people would be aware of. There is a reduction in the enzymes, and some people genetically don't make nitric oxide as efficiently as others. But nevertheless, if you're not breathing through your nose, if you're not, tapping into all the different things you're talking about, doesn't matter what your pathways are doing, you're not going to make enough nitric oxide. So you want to optimize all this upstream stuff. But for the expansion of the jaw, that sounds awfully painful. Is it painful?
No, the reason why it's not awfully, actually you might have read about it in the book Breath. James Nestor wrote about he actually went through through the appliances, and Dr. Pelfor is the one who actually taught me how to do this stuff personally. So what happens is that we now know the stem cells, where they are in the roots of the teeth, so we can activate them. So what we can actually do is because it's not active force all the time. It's active force, passive force, active force, passive force, kind of like inhalation, exhalation. So it's that natural body rhythm. Because it's that natural body rhythm, it's not painful. So that's the beauty of it, is because we now know the frequency at which we can activate the bone making cells. We activate them.
That's so cool. Okay, we're going to have to talk about this. So is this a procedure that's done in the office, or is it okay, I have so many other questions. We're not going to talk about this for much longer, but maybe other people are interested too. Or is it a device that people go home with and then just use, let's say at night or intermittently through the day?
Sure. It's a device that, because we want to do the expansion, it's a device that you wear at night, and you actually do have to activate it every couple of weeks. And so, but it's actually really easy. the beauty of it, it looks like a retainer, but it's not a retainer. It has so many cool features and function in it. So it looks safe, you know? And so
it doesn't look scary.
Yeah, it looks actually, it's really easy. And then what we do with it is we activate it in, over a period of time is we're going to grow that bone. So we're going to grow about 0.25 millimeters, like very, very, very slowly. My ideal goal is to grow about 2 millimeters or so, which is going to take me about 2 years, but it's a very slow and easy process and it works really well. So highly recommended. It's something that does need to be done by looking at a provider. The main reason is because we quantify everything. We data test.
Sure.
So I want to know how much I'm going to grow by, what are going to be my results after. So we actually take a CT scan before we do the treatment. We do a CT scan after. We also look at your vitamin D levels. We're also looking at, because of course it's important in bone making, right? We're also going to be looking at your sleep study, seeing if you have apneas or if you have like the respiratory effort that is needed. Also looking at how we can take patients off of so many different medications, help them feel better, help feel younger. And in fact, the other thing I always see with patients is they always look 10 years younger because they're now getting hydration. Their body cells aren't working as hard. They're getting the nitric oxide. Their jaws are in the right position. Their skin is much tighter. So it just really helps the telomeres from unraveling. It really helps with that for sure.
The only reason we knew there was a problem is this is a guy who thinks he sleeps well, but doesn't matter how much sleep he gets. He's always tired when he wakes up. It's like, that's not normal, right? And this is an active, smart, engaged individual, not a drinker, not a smoker, no drug, like, you know what I mean? Like something wasn't adding up. So, okay, but I don't want to stay on that too long. That's super fascinating. There's lots of other questions I want to ask you, and we're already over half an hour in. So just to finish off, I think it is fascinating, guys, also when you're dealing with a holistic dentist, that these are people, they're dealing with the whole body, but you're looking at sleep is such a massive focus. And it is, I just interviewed Dr. Bruce, Michael Bruce, who I'm guessing you probably know who he is. And in his mind, it's sleep, hydration, and breath. If you can get those three things dialed in, everything else will fall into place. And so, the fact that here we are talking about the oral microbiome and we haven't even talked about the pearly whites, the teeth that supposedly dentistry is all about. Like, we haven't even gone there yet. It's so fascinating to me. And from a longevity perspective, if you're in what you're saying here, like if somebody's in their 50s or their 60s or even beyond, and have a look at this type of work, and this can actually give you more energy and make you feel younger and look younger and operate better in your life. That's amazing, because what we're looking for is health span. We're looking for how well we're going to age, not just hanging on tooth and nail, not wanting to die and being decrepit and dysfunctional kind of as we age. So I love this discussion. So there's a couple of hot button issues in the space that I'm sure you deal with all the time. And these are fillings, cavitations, root canals. Like, these are topics that are definitely starting to bubble up. So this whole issue of amalgam fillings versus other options, like it's a little bit, it kind of blows my mind a little bit that anybody is still not using inert materials for fillings. Do you want to talk about that a little bit? And
Yes, absolutely. So amalgam fillings, definitely don't want them. And I definitely think they need to be banned from even, not just here, but anywhere in the world, any third world country that makes mercury, any kind of mercury that is released, and it's a toxin, right? And, earlier, we were talking about the airway and the breathing and all that stuff. And the other thing I was going to bring about was detoxification, because these are toxic things, right? The reason we focus on the airway and all of that is because not only does it help you, avoid, obviously prevent all these bacteria and stuff like that, but it also makes your body detox on a regular basis from the food, the air, and all these toxins you're exposed to. So when we're looking at mercury is a toxin. Now, that mercury vapor is what's released when you chew and grind or have a hot cup of tea. That amalgam sitting in your mouth has silver, tin, all these other, modalities in there, and it's kind of structurally tight. But when you chew and grind, it releases that vapor. Now, that vapor is what gets absorbed by your body. And that vapor, when it gets absorbed by your body, actually binds to your DNA. So when it binds to your DNA, instead of making an apple, it's going to make an orange because it's going to switch out one of the amino acid. And so mercury should definitely not be around, should not be used. In my practice, we use a inert product, and we use porcelain. The type of porcelain we like to use is Emax, and it's really great because it's like having your natural tooth. It's not even, you can't wear it down. It's made of silica particles. And so especially because people tend to clench and grind their teeth so much, the hardness on it is great. It's not like a plastic material because plastics tend to, you tend to wear them down more. So these Emax silica particles, hard silica particles actually are stronger and they last a long, long time. I've been practicing 20 years. I still have fillings I've done 20 years ago in people's mouths. I still have my first patient. So I still have all these crowns and fillings that I've done and still in the mouth and still intact and just fine. It's because we looked at the root causes and made sure that we're helping them keep the biofilm away and making sure they're not clenching, grinding all the airway and everything like that is in order. The other thing I want to talk about is root canals. Now, root canals is a different topic. Okay, so root canals done 20 years ago was crapola, is what I like to say, because they just didn't have the technology back then. But as time has evolved, we now have technology, the red light bacteria we talked about that are known to cause that lower grade infection, which is known to cause disease. Those bacteria actually can be removed through lasers. So we can now use lasers in root canals and make sure that they're safe.
Oh, so there's a good way to do root canals now.
Yes, we want to see the tooth.
Until now, it was like it was about leaving holes in people's mouths. Like,
exactly. And the reason we don't want to do that is because the teeth, actually, the roots of the tooth actually have stem cells around them. So we want to try to preserve them as long as possible. And that's the reason why we like to keep the tooth. And now that we have a safer alternative, it's fantastic. It's root canals that you hear stories about are root canals that were done not so well. They were done by a general dentist and the quality of work wasn't as good. But now, because we have precision, we have rotary instruments, we have laser technology, root canals are done very well and they're done very safely. And you can actually monitor those root canals on CT scans because even if there's a small little foci of infection, we can see what that looks like. We also use ozone therapy to make sure that everything is super nice and clean. So we definitely have a better way of working with root canals, and because we do want to try to keep the tooth. Now, the last thing you asked about was cavitations. Cavitations, unfortunately, there is no other way than to get the cavitation out. Cavitation is basically a foci of infection left behind when a tooth is extracted. A lot of times it was done when wisdom teeth were extracted. You can even find it now if there's a general dentist who's just doing the extraction and not cleaning the socket, because a lot of times the reasons why you're getting the tooth out is because there's infection or something along those lines. Even with wisdom teeth, they're trapping bacteria or anything along those lines, right? So there's usually like bacteria sitting at the socket. If the socket is not cleaned and the periodontal ligament is not removed, then it becomes a cavitation, where it becomes like a brewing ground for bacteria to overgrow. And that's what we find in patients with cancer, Alzheimer's, any of these, conditions that we talk about. So here's the reason why cavitations are a big issue. If you got sick for 7 to 10 days, I'd be like, great, your immune system is fantastic, Natalie. You should get sick for 7 to 10 days. You're making your system work, and we want it to work. Right. Now, with this low-grade infection like a cavitation that you never feel, that you really don't see unless you're really looking for it, this low-grade infection over 5 years, 10 years, 20 years starts wearing your immune system down because your body's always fighting those bugs. That's when the problem starts because your body is not fighting cancer, it's fighting this infection. So that's the pathophysiology or the way to think about it when we look at cavitation, how important it is to get rid of cavitations. And also, same thing with also active gum disease. It's the same concept or these bacteria that we find from dry mouth. It's the exact same thing. It's a low grade infection. We can't smell it. We can't taste it. We can't feel it, but it's there.
Yeah. So how do you find the cavitation? Is it through imaging? And then how do you get to it? You have to open up the incision. You have to open up, get back in there again.
Yeah, you have to get back in there, clean the area out. I usually like to put ozone in there to make sure that everything heals up, and it needs to be cleaned out. You can also try ozone injections. It just takes many ozone injections for the cavitation to be better. But that is a possibility if somebody didn't actually want to go through the surgery itself. But, nowadays, I would just say if you're my brother, sister, or mother, I would just get the cavitation out and call it a day. It's like, you'll suffer for maybe 7 to 10 days, but then you'll be over it afterwards. And you will have that confidence in health, because that's the other thing we're looking for, right? The reason I love what I do is, number one, root causes, but also I want to have that confidence in health. I want to know I'm aging gracefully. I know I'm doing everything I can. I don't need everything in the world, but if I can find ways to make my body work properly on its own, that's when we've hit the jackpot.
100%. 100%. I mean, I've always said that the body has ways of healing that we can't even touch, right? So if we can remove those obstacles and that kind of chronic low-lying infection or inflammation even, is that it's that constant noise that's, if anything else, it's a distraction to the body systems that they can't be worried about maintaining and repairing when they're just constantly fighting a war.
Exactly.
That's kind of the way it works. You mentioned something earlier about in the 40s, really things start to change. Would you say, does menopause affect the oral biome?
Absolutely. Hormonal changes.
You want to talk about that? Yeah.
Absolutely. Hormonal impact they make a huge difference. Now, just like pregnancy, there are hormone progesterone tells the body you're pregnant. It acts as a growth factor for bacteria to overgrow. What happens in menopause is when we see that estrogen dominance start occurring first, and then we see a lot of those changes that occur. There's several things that happen. One is that in our 40s, we do drop in D3. So very important to look at D3, B12, B1, B5. So those are the vitamins that we really want to be looking at. Because the reason I say D3 is because your D3 is your precursor to your thyroid, right? So it's part of your thyroid, and we want your thyroid to work really well because it's part of your immune system. So
you're saying D3 or T3?
D3.
D3, vitamin D3,
yeah,
which is a hormone. Yes. D3.
Yes. Okay. So really making sure that D3 is in really good spot, because as we, our hormonal fluctuations start occurring, right? And so there's a lot of things that can occur. Sometimes there's dry mouth. Sometimes there's burning sensation in the mouth. Sometimes there's just more bacterial overgrowth. Everyone kind of responds a little differently. So we really have to look at that. And then second thing we have to combine that is with that tongue position changing, right? So if you start looking at that tongue position, which is naturally going to change, the other thing that starts happening is that what I also see in women is sinuses. We see if there was mold exposure at one point, or, some small allergies that were there at some point, but 40s, they start really acting up. And when they actually do the CT scan, I'll actually see their sinus cavities filled with bacteria and fungus. So those things also occur. And if that occurs, you're going to stop breathing through your nose. You're going to start mouth breathing. So again, all those things that start happening because of age, because remember, when you were younger, your body was better at detoxing. It was actually better at getting rid of stuff, right? You bounce back so quickly. Now it's like, even when I go on a vacation, I need an extra day just to get over my vacation.
You need a vacation from your vacation. Yes.
So our bodies work differently now. And so really looking at, the biggest things we're looking at is, again, vitamins. We're looking at, oral microbiome, of course, and then looking at that functional airway. Those are the three things as a dentist that I'm really looking at. And then the last thing I would say is a cortisol balancer, because usually 40s, high-powered women are in their peak. They're doing everything great. But it's not just about taking magnesium at night anymore, but having something that absorbs our cortisol, because we see a lot of grinding. So those would be some things that I would recommend, and I would, advise women on. But these are some things that I see in the practice, especially, the 40s to, I would say, 55.
Yeah. It's really interesting. So flipping around to the other side of the spectrum, do you deal with children?
I do.
Because
some children have to be.
Yeah, because as I'm sitting here listening to you, I'm wondering if instead of braces, people should be looking at children's palates and working on that before you even start rearranging teeth. Because if you created more space, is it possible that the teeth would naturally just move into a better place?
The first thing we need to look at for children is their tongue. So if we can start breastfeeding for longer, for 2 years versus 6 months or 3 months or 4 months, right? That's the first step. The second step is myofunctional therapy. So tongue training exercises. So starting those for kids at the age of 2, 4, 6, because if the tongue is working, probably the tongue is what's guiding the teeth in place.
Interesting.
So yeah, and that's what's developing their jaw. Because remember I said earlier, like if there's somebody sucking their thumb, their palate that should be felt like that ends up being like this because their thumb went right in there.
Oh, and so that it naturally will narrow.
Narrow V-shaped arch. Exactly.
Yeah.
So because I remember at those ages, the body is still responding. Actually, our entire life, our bodies are responding, right? If you go to the gym and you work the muscle, you're going to get more bone density. The same thing is happening with myofunctional therapy, tongue training exercises. That tongue is being, is an activator for our bone to grow in specific ways. And we're designed that way for a specific reason. And hence we're mammals. We're designed to lactate, right? We're designed to be breastfed because it actually develops our functional airway and it develops our sinus cavity because the tongue develops and then the palate grows, right? And then the sinus is right on top and then the functional airway is right there. So that's why starting early is really important. But I would say start with the breastfeeding, then add the tongue training exercises, then the growth appliances.
Right. But before braces, maybe.
Oh, yeah. Maybe no braces at all. We maybe don't even need them.
No, I know. I mean, the orthodontist listening to this going, no. None of that. I mean, I was fortunate enough never to have braces, but I remember when I was at a certain point in school, everybody had braces. It was kind of like this weird rite of passage.
Well, I was going to say, we are a tooth conscious society. We're into beauty. And, as you were saying, the beautiful smiles, I want to look good, but I want to feel good too. I don't want to just look good and have disease, that's the problem, is shifting people from, just looking good to, you got to have health as well, right? You can't compromise your health and look good. That doesn't even or feel bad. Like that doesn't make any sense. I always say looking good, feeling good.
What about breath? Do you talk about that much? Like, I mean, halitosis, the dreaded halitosis, which, some people just seem to have really bad breath. Is it always bad hygiene, or can that in and of itself be a sign of something more serious brewing?
It actually is a sign of something more serious brewing. Halitosis or bad breath can be made from sulfur-causing bacteria. That's one. The other time is dehydration. A lot of times it's acid reflux or diabetes too. So those, we'll actually get that breath from patient or even patients with sleep apnea because everything from the stomach is coming up, right? So we'll see a lot of the smell of the bacteria and also like acids that are occurring in the mouth. And so if there is halitosis, I always say, if brushing and flossing doesn't remove it, you've got something serious that needs
something
to be
else
handled.
going on.
Yeah.
Because so it's kind of like the saliva being a secretory, like being a secretion, so indicating systemic imbalances. Same with the breath. And it's interesting that you mentioned the breath as detoxification, because I think that is the pathway of detoxification that is the most underused and underestimated. Everybody knows sweat, liver, poop, pee, but we often forget that breath is a detox pathway.
Yeah. And it's it's autonomic, which is great. So that's why I like optimizing anything that's automatic. To sweat, you actually have to work to sweat, right? With the breath, it's so autonomic, your body's designed to do it. So do it and do it well, let's optimize it.
So let's talk about some of the products that are out there for teeth. So there's toothpaste, there's mouthwash. Now, this audience knows, or at least most of them know by now, that, the conventional mouthwash is just like napalm for your oral biome. But do you want to talk a little bit about some of the products that people should look out for, some of the products people should be looking for? Like what's the best, what should people be looking for in terms of oral care?
Honestly, I would always say less is better. So did you know that actually toothpaste is marketing? You actually need an electric toothbrush. if you brush your teeth with an electric toothbrush, you would get a much better job than any brand you picked. So toothpaste doesn't
Like
really
without
matter.
toothpaste.
Yeah, it's a mechanical action of brushing that actually removes the biofilm.
That makes sense.
So that's what we really want to do, is use the mechanical action of brushing. I do have my favorite toothpaste. I would say, like, my favorite toothpaste go-to is Boca, Boka. I do like to feel fresh in the morning, and it's okay. We're a superficial society. We can just embrace it and not judge ourselves, right?
It just makes you feel awake and nice. It's okay.
Yeah. So I usually say, I like to use a Boca toothpaste. It has nanohydroxyapatite, which really helps remineralize the tooth structure, helps prevent cavities. So I like to use that. Then the other thing I always recommend, I would say floss first. Mm-hmm. And the floss that I like is cocoa floss. It has coconut oil in it already. And so that's fantastic. So floss first, brush your teeth, and then scrape your tongue.
Yeah.
Because if you scrape your tongue and if you do those, you actually won't have bad breath as long as you hydrate throughout the day. And if you get bad breath, instead of, reaching for a mouthwash, my preference for you is to use a probiotic, a lozenge that is in the mouth. The one that I really like is by BioGaia. And it's really fantastic because it's made for teeth and gums, and it tastes like a breath mint, and you can have it several times a day and it's no problem. But what you're doing is you're even getting L-glutarate that's going to help with your oral microbiome as well as your gut microbiome. And there's only one strain in it, not multiples of, which I really like as well. And so it's a little bit easier for everyone to palate, even patients with IBS, because you really want to make sure, what kind of microbes you are taking in. That really helps out a lot. Hydration and probiotics would be, like, I would say, ditch the mouthwash, add in hydration and probiotics. Those would be the way that I would share with you.
Nice. Now, you mentioned Ayurveda earlier. What are your thoughts on oil pulling?
Oh, I love oil pulling. I think oil pulling is fantastic. But if somebody ever thinks they're doing oil pulling to, get rid of gum disease or something like that, it's not true. The purpose of oil pulling is to detox the whole body. It's a good binder. The reason why you have to swish around for 20 minutes is because it's a good binder. Underneath the tongue, you have a lot of vessels, so blood vessels. Yeah. So what you're doing is you're helping the liver loosen things up, and that coconut oil is just a good binder. It's antifungicidal, antibacterial, and it works really, 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 really great. And then you're going to spit it out. If you have gum disease, it's going to help a dry mouth, but if you have active gum disease, it's not going to solve the problem. You got to see a dentist. And that's why I wanted to preface it, because sometimes I have patients come in, I've been oil pulling. And I was like, well, where you are, this condition is advanced. Oil pulling is not going to solve the problem. You unfortunately have so much bacteria built up that we can see it on x-rays that has to be scraped off. So I always like to share that with people listening at home, because sometimes we don't know the condition and it's kind of hard. What happens is that people end up not seeing the dentist soon enough, and then it causes a lot of problems. So that's the reason why I wanted to share that message, is because as a dentist, I see it all the time.
Yeah, well, it's good information. So it's good prevention, it's good maintenance, but it's not a treatment. It's not a therapeutic treatment.
Yeah.
Okay, so talk to me about lasers. You talked about lasers for disinfection, and if you're dealing with a cavitation. You talked about lasering the tongue so it doesn't have bad wrinkles, so that it works better. And then I think in passing, you mentioned lasers for the gums as well, right? Is that for basically the same type of laser where you're going after bacteria?
Yes. With
the lasers, and is that instead of the scraping, or is that in addition to?
So sometimes it's in addition to, is all what I always say, because there's, some bacteria, when I tested 13 species of bacteria, some bacteria can only be scraped off, some bacteria can only be lasered off, some bacteria need ozone, some bacteria need different things. So I usually like to do a protocol of a lot of different things and customize it for each patient. So usually we do the scrubbing just to make sure that the root surfaces tend to be porous, and we want to plane them, make sure they're really nice and smooth. So like a smooth surface so bacteria doesn't keep sticking to it. If they're microscopically, if there's reflux, microscopically, they're a little rough, it'll keep harboring bacteria. So we always want to make sure the surfaces are smooth first. Then what we do is we use a laser. So the purpose of the laser is, if this is my tooth, those of you listening at home, I'm pointing to my hand, and then I have a long sleeve shirt. So that would be like my gum. So when we're talking about oral systemic connection, we're not talking about bacteria on the tooth. We're talking about in the root or the base of the pocket.
Yeah.
And that pocket has access to your bloodstream. right? That's why we call it the oral systemic connection, because there's a lot of vessels in there that have direct connection to your bloodstream. And if something can get in your bloodstream, that's when it's potent. That's when it's really bad. So we want to keep things out of the bloodstream. And we want to do that without having to do antibiotics. So the best way to be able to do that, or toxic mouthwashes or anything like that. So the laser therapy is fantastic to be able to get rid of the bacteria. Number one. Number two, it also does photobiomodulation, so it helps heal. So that's the second reason I love it. So I'm a big user of lasers in the practice. And again, we always retest to make sure that we got the bacteria out.
Yeah, that's fantastic. Okay, another little quick fire question for you. I'm sure you've seen these, and I'm curious about your opinion. They look like mouth guards you put in your mouth, and then they either do blue light or red light, and they claim to be really good for the gums and oral health. Yeah. What are your thoughts?
Well, I feel like my honest professional opinion.
Yeah, no, that's what I'm asking for. I mean, this is what we're here for.
Yeah,
it's honest professional opinion.
Yeah, it's a bunch of caca is what I like to say. It makes us feel good, but in all honesty, if you stick to the basics and do it well, and you're good. If you want to do, if you're worried about gum recession, you need to get to the root cause of the gum recession. You really need to figure out what's going on. And the other thing is you got to realize that if you're doing this stuff too much, you're imbalancing the microbiome. And that's what people forget, that, less is actually more. If you do too much of something, it actually can be damaging. For example, gum recession is a perfect example. People brush too hard sometimes, right? Yeah. They think they're doing a good job, but you're actually hurting it, not helping it. And that's why I say with all these things that are out there, sure, they're out there. They're mainly designed to make you feel good. But as far as scientific evidence, it's not a treatment, like you said earlier. If you wanted to do it to make yourself feel good that you're doing something, because sometimes we like a sense of control, fine. But if you're looking at really, it's not, if you've got gum recession or if you've got active gum disease, it's not a treatment for it.
Yeah. Okay. Got it. As we're coming to the end of our time together, this has been a great conversation. I have two quick fire questions for you. One is, what are the signs people need to look out for that might indicate that there's a deeper issue they need to address through the mouth? Are there specific signs and symptoms people should be looking for? And I would say even like beyond the bleeding gums and that kind of stuff. So that's the first one. I'm going to leave you with that, and then I'll give you the second one.
Okay. The first thing I would say is if you are, wondering if there's something going on, when you wake up in the morning, wake up and then put your hand in front of the mouth and exhale and see if you have stinky breath. Because that stinky breath is going to give us an indication that you're mouth breathing, you have acid reflux. It's going to give you the first clue, because you should not have stinky breath. And if you do it for a couple of days, you'll realize if it gets severe or less. Like on nights, if you had too much wine one night, you'll notice that it's a little different. So really, and then also, once you get treatment and stuff, realizing what healthy breath is, because that's an easy test you can do. It's your own breathalyzer.
Yeah, exactly.
So that's the first thing I would say, check that. The second is also, if you put your tongue around your teeth. And if you feel roughness or sweaters around your teeth and you just brush your teeth and you're getting them like within like an hour or two, you've got an issue, because there's no reason that bacteria is dividing so quickly that you shouldn't have them develop that. I mean, they should be there, but you shouldn't have like a coating of it on your teeth. So you definitely want to get checked in. That means that either maybe maybe we need to review brushing with you, figure out what's going on with that. Or maybe you're building up more bacteria. It could be a side effect from a medication. It could be, anxiety. It could be dehydration. It could be just a number of different things. So we want to check that out. So those two things I would say are simple and easy to do.
What are 3 to 5 things that everybody needs to be doing to optimize their oral health, so in order to positively affect the rest of their body? Because we're going to now say this is not just about the teeth. This is about the whole body.
Yeah, absolutely. Thank you. That's a great question. I'm so excited to share with you. We're going to move on from brushing and flossing, because we know that's outdated. And of course you need to do that.
Well, you need to do that. It's kind of
it's like 20 years ago. Let's talk about current things. The first thing I would say is, Natalie, as soon as you come home, I want you to shower. The reason is I want you to get all the toxins out of your body, on your clothes, all of that. Change your clothes out, put your shoes away, all that stuff. So first thing is shower. Second is open your sinuses. Pick those boogers out. I want you nasal breathing. I want you nasal breathing. And if you have trouble with, nasal breathing, I always say aromatherapy in the shower is really fantastic because it's steam, right? So you can put a little bit of eucalyptus in there. If you need something a little bit more medicated, you can use a xylitol spray called X-Clear.
I love that stuff.
Yeah. Or B propolis. Those worked really great. So let's open that sinus up. That's the first thing I would say. That's what you're going to start. You're going to go through your day. You can have dinner or whatnot, get home, have dinner, all those things. Before you go to bed, I want you to obviously floss first, brush your teeth, scrape your tongue. Then what I want you to do is I want you to do some box breathing. I want you to create some nitric oxide, right? So I want you to breathe for 4 seconds, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds. I would say do about 20 of these and we're going to activate that vagus nerve, that rest and digest nerve, which is amazing. If you're stressed out, you can also tell your brain like, hey, my subconscious mind, I need help processing something. So whatever solution you may be looking for, give your subconscious mind an assignment to do. So we're working smarter, not harder. And then I want you to mouth tape and go to sleep.
And mouth tape. Nice. Mouth taping, obviously, as long as you can breathe through your nose.
Yes, of course. And not something too tight. I've seen those hostage tapes. They look really horrific.
Well, the language alone is a turnoff. Let's just be clear.
Right. Just something very, very loose. And just to make sure that you are, one of the things I find is like you're in Canada, right? So in the winter times, you're going to be more stuffy, right? So that's going to be a problem. And so having that looseness it gives your body or your lips the ability to open if they need to. But you're not forcing it to mouth breathe all the time. And it's actually forcing you to more nose breathe than mouth breathe. But if you needed to open your mouth, you can. Actually, I have one more suggestion. The other thing I was going to say now that we're talking about Canada, in the winter times, making sure you have a humidifier.
Yes.
Yeah. Because the quality of your breath is going to be equivalent to your, if you have humidification in there, that's going to be really, really, really helpful for you. And if you wanted to put some lavender in there, something to help you ease and relax more, even better, because that works really well.
Love it. Thank you. Dr. Nami, this has been fascinating. Why don't we tell people where to find you and how to find your work and all the things that you do?
Oh, thank you. Well, if you want to know a little bit more about me and how I work, we actually do telehealth as well. So my office website is called SF, as in San Francisco, Green, GREENDENTIST.com. I also do a lot of speaking and I also do a lot of coaching. So if you have a dentist or a medical doctor that you want me to connect with and share them how dentistry can help, basically what they do, make it more effective. So I really help coach other providers. And that website is Dr. Nammy, DR, and then NAMMY, Patel, PATEL.com. So you can check that out as well. And let me know how I can help in any way. Or you can always email us, sign up for our newsletters, anything like that. So
amazing. I love it. Thank you so much. This has been great. And I'll be following you. So much of this is very, very fascinating. Thank you.
Well, I was going to say, come visit. I'd have to say a lot of my patients come visit me from all over, actually, which has been a lot of fun.
They do.
Because a lot of us are interested in this stuff, right? Like it's not just your routine dental office. And like you said, you've seen a holistic dentist, right? And just the stuff that we're talking about, especially when it combines with longevity and really biomarkers and looking how we can really do this with precision is really fun. So come visit, Natalie, anytime.
I will. I love San Francisco. It's a great city. Thank you.
Hey, folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider.